Client single case design completed by Terri, Sloan. Demographics. My client is a 23-year-old African-American female who is single. She has no children and is located in Johnson City, Tennessee. She reported an income of $800 a month and considers herself low income. She has no history of mental health issues. She reports an overall good health and development. She's never been hospitalized and has no major health concerns. She takes no current medications and has no past history of medications. She reports being in the same weight range for the past 5 years. She reported that she has gained weight since starting graduate school. She does not have time to cook and eats a lot of fast food, and she's cut down on her weekly exercise. She feels her appetite has changed as she is less hungry throughout the day. She reports making an effort to eat at least 3 meals a day. Client reported attending Austin East Magnet High School of Performing Arts. She attended ETSU for her undergraduate degree and is currently a first-year graduate student at ETSU. She is pursuing a master's degree in social work. She reported that graduate school has reduced a lot of stress for her. The client has no past history of drug abuse. She mentioned that her maternal grandfather used drugs. She's not sure exactly what kind. She reports that her grandfather passed away from lung cancer. Client reports no history of physical, sexual, or emotional abuse. She currently lives in Johnson City, close to her college campus. Her family of origin includes her birth parents, 2 older sisters, and 1 twin brother. Her parents have been married for 28 years. Her older sister is 28, middle sister is 26, and her twin brother is 23. She reports having positive and supportive relationships with her siblings. She reports being very different than her twin brother, but their relationship is good. She reports talking to her mother or her boyfriend when she needs someone, and she feels that she can talk more openly with her boyfriend than her mother. She has one best friend but is unable to connect with her regularly due to both of them having busy schedules. The client reports working at Texas Roadhouse and Boys and Girls Clubs in Knoxville in her past work history. She currently works at Little Bucks Child Care Program for ETSU in Johnson City as a GA. She says she loves her job with Little Bucks and it's by far her favorite. Client identifies as a Christian. The assessment. The client presented a complaint as far as her problem is stress related to grad school. She identified stressors related to time management and lack of self-care. She explained that she often waits until the last minute to write papers for school, which increases her stress levels. She feels out of control with her time most of the days during the week. She has a GA position at Little Bucks and often feels overwhelmed with everything she has to accomplish every single week. She shared an instance where she forgot that she had a presentation to do for her GA position at Little Bucks. She was stressed because she was unprepared for her presentation. She often experiences stress because she has difficulty finding time to practice self-care and forgets important tasks that she must complete for school and work. She feels she needs help managing her time and needs to have more time for self-care. She reported that her grades in graduate school are starting to suffer because she is overwhelmed with stress. The client wants to focus on stress-related time management in graduate school and lack of self-care. Quantifying the problems and measurement. I chose to use an individual rating scale and a client log. The IRS measurement was used to quantify the client's stress levels. The IRS scale was constructed with the client. The purpose of the IRS scale is to measure the severity of stress the client is experiencing. The client agreed to select the IRS anchors. 1. Feelings of no stress. 2. 3. Minimal feelings of stress. 4. 5. Moderate feelings of stress. 6. 7. Most stress I have ever felt. She also agreed to record her IRS ratings in the log every evening at 6:30. The rationale for choosing this IRS scale. The client reported feelings of stress related to graduate school. This measurement will show a clear picture of the client's stress as it relates to her everyday experiences. The IRS clearly measures the identified problem of the stress, which ensures content validity. Scoring. The IRS is scored using a rating dimension. The IRS is set up with 7 responses, categories ranging from 1 being no feelings of stress to 7 being the most stress she has ever felt. Reliability of the IRS. Client will measure stress levels every day, the same time, to ensure measurement reliability. Goal setting and case formalization. You'll see here that the client's baseline stress. Baseline graph was discussed with the client, and she agrees that stress is a problem for her. The baseline graph indicates the problem of stress actually exists. The initial goal was discussed. The baseline is somewhat stable with some variability. She experienced high levels of stress, the most stress she's ever been, at least 4 times during her baseline. The other times she felt stress was around level 5. After reviewing her log and IRS data, the client has a busy schedule all week. She works at the GA Little Bucks Monday through Thursday from 7 to 1 or 3. She also is a part-time graduate student. She was full-time but became overwhelmed with stress and changed to part-time. She has time for self-care, but sometimes on the weekends she chooses to do schoolwork that she put off during the week. She feels she needs to manage her time better and needs more time for self-care. She has not set a schedule to manage her time and often neglects self-care. Problem: client is feeling stress from graduate school work and lack of self-care. Our goal: she will decrease her stress level related to graduate school and homework. Her objective: client stress level will rate a 3 or lower on her IRS scale. Evaluation design. I chose to use a basic A-B design to evaluate clients' progress towards initial goal. This design was used in this study because there are only 1 baseline phase and 1 intervention phase. The baseline phase did confirm the existence of the problem. Advantages of this design: the baseline phase can be used to confirm or disconfirm the problem. The extent of the problem can be established. The baseline data can be used to develop case conceptualization and the intervention planning. The A-B design is a good starting point for more complex designs. The A-B design can be added to in response to ongoing client change. For instance, if we wanted to do a second intervention, we can use an ABC design. Disadvantages: the A-B cannot be used to determine the extent to which an intervention actually causes the change for the client, or whether the client change will last over time. Other designs were not chosen for the study because only 1 intervention phase was used during the study. Intervention. After discussing the baseline data with the client, she agreed that she needed to create a schedule for each day of the week that planned out her day by the hour and tasks that she needed to complete. She will also set aside time for self-care each week while ensuring she meets her homework obligations. She feels that time management will greatly reduce her stress levels and give her time to practice self-care. She created her weekly schedule for Monday through Thursday and agreed to set Friday through Saturday for rest and self-care. The rationale for this intervention: the client expressed a need for time management to help manage her time and self-care to reduce stress. Creating a schedule allowed the client to plan her day-to-day tasks while setting aside time for much-needed self-care. The client expressed that she has poor time management behaviors that are contributing to her stress levels. Upon research, I found an article called "College Students' Time Management: Correlation with Academic Performance and Stress." In this article, it discusses the correlation between time management and stress. According to Robert DuBois, it says here that many college students may find academic experiences very stressful. One potential coping strategy frequently offered by university counseling services is time management. 165 students completed a questionnaire in the study assessing their time management behaviors and attitudes, stress, and self-perceptions of performance and grade point average. The study found that students who perceived control of their time reported significantly greater evaluations of their performance, greater work and life satisfaction, less role ambiguity and less role overload, and fewer job-induced somatic tensions. The study found the correlation between time management and stress. I found also in the results of my study and watching data with my client, as she actually created her schedule, her stress levels did actually reduce over time. Here in the data analysis, we can see that my client's stress did reduce. However, it's pretty variable. She did meet her goal, but it didn't stay consistent throughout the week she put her intervention in place. The client started intervention phase by creating a set schedule for each day of the week. She set days specifically for self-care and days and times for homework. The client was able to gain control of how she spent her time and decrease her desire to procrastinate. During the intervention phase, the client did meet her goal of reducing her stress level to 3 or less. However, not consistently. She often fell below her goal line on days she set aside for self-care. The outcome, creating a schedule, did help the client reduce stress below her baseline levels. She was able to consistently practice self-care and time management. There was a lot of variability present during the intervention phase. We made no changes to the intervention as it did work for her, and no changes in the case conceptualization. For conclusion, the results as relation to the literature that I chose: poor time management behaviors can lead to higher levels of stress. The client in the study reported high levels of stress during her baseline phase, often saying she procrastinated and waited until the last minute to study or write papers. This led to higher levels of stress and poor academic performance. The results show that the client was able to reduce her stress levels when she gained control of how she spent her time. She was able to set aside time for self-care, which further reduced her stress. The study does not show evidence that the intervention was the cause of the change. However, the client expressed that having a set schedule helped her feel less stresses. She was able to work ahead on several homework assignments. The strengths of this evaluation: the client was able to see the source of her stress by seeing the IRS rating graph. Weakness of the evaluation: only one intervention was used, which did not address the possible cause of stress outside of school and the client's GA position. I would definitely try a second intervention and baseline phase to further evaluate client change. The client reaction to intervention: the client really did a good job of creating a schedule for herself and actually sticking to the schedule. She taught herself how important it was to practice good time management to reduce stress.